It's a big honor to be the first lecturer, the first moderator of this fantastic meeting. It is the third global conference of MIS, this time in Barcelona. This is Firenze, Florence. Everybody wants to go to Florence. Art, architecture, culture, food, wine. Me too. So I met some people from the Society of Pedontology of the Italian people and told them, I know you have planned a meeting next March in Florence. Maybe I can come there as a speaker. So the guys look at me and say, yes, why not? But what special thing you will bring to Florence? So I had a spark of memory from a TED lecture I heard not so long ago, and it was about Leonardo da Vinci. So I said my talk will be entitled, Think Like Leonardo. Well, I was invited, but then I came back to my office and said, well, this is a nice title, but what will be the content? So, Leonardo's thinking can be summarized by 3 rules. Cultivate curiosity, interrogate everything. Think scientifically, base your thinking on science and biology. And be creative all the time. And this is the DNA of MIS. I'm with MIS for almost 20 years, see it growing, and these 3 Leonardo rules take MIS to new places every time. But now we are in Barcelona. I love this beautiful city and love to visit it again and again. It's a good choice for a global meeting. And like Florence, Barcelona has her own heroes, Gaudi, Dali, Picasso, and more.
Suarez, Messi, that's right, Neymar, Glasses down, Neymar lays it off to Suarez!
And this is the Barcelona trio, taking the football club here to unlimited heights. But if you want the next season, not this season, next season, to win the Champions League, every coach knows you need to bring new star players every time. So MIS brought the MIS trio, Nitzan, Yuval, and Eric, which will play a central role in this meeting. The present global MIS conference will focus on several things. 2 of them are the V3 concept, the V concept of the MIS trio, and digital dentistry, which is leading the dental field now to a new arena. The V concept is an evolution of implant dentistry. It's also based off 2 of the Leonardo concepts. Simplicity is the ultimate sophistication, which is also the logo of MIS, make it simple. The surgical evolution is simple, scientifically based, and creative. Small change, different results. 2 millimeters of bone thickness. That's what we need to preserve our initial results for long term. And this is supported by many scientific articles from the literature. One important novelty is that the V3 evolution is calling for more bone when we need it. In the implant neck area, which always need more bone without compromise the level of osseointegration and primary stability. The bone width created by round implant can be modified to a wider bone by changing only the neck design. It is based on the scientific evidence. The small gaps between the implant and the bone are filled with blood and healed spontaneously without the need of any graft. It is brilliant. A second novelty of V3 implant is less cortical compression on the bone by the implant neck due to the special triangular design. Less pressure, less bone resorption. It is based scientifically in the dental and non-dental literature. A second novelty, in the clinical situation like this, you can see the round osteotomy. The shape of the implant that fitting the preparation. We can appreciate the width of the bone after the osteotomy and the space creating, giving a chance for a wider bone where we need it. It is simple biology, and this V3 concept follows the biological principle for more bone volume, more vital tissue, and more vascularity. The second theme of the global MIS conference will discuss the new digital revolution in implant dentistry. This revolution changed the face of our clinics, starting from paperless office, digital radiography, and digital workflow. In the field of implant dentistry, we are using the technology of the cone beam CT, which gives us the bone image in 3 dimensions and the optical scanning of the models. More and more using the intraoral scanners, which are getting better and better. No more patient choking during impressions. The combination of these 2 digital machines enable us to create digital plans for our patients. As an example, I brought a recent challenging case. Many teeth are missing. The edentulous span is wide. 2 or more teeth in the middle, 42 and 43, need to be extracted. Furthermore, we are limited in the space for the implant due to the course of the inferior alveolar canal. Using the MGUIDE software, we designed placement of 5 implants. Some of them are only 6 millimeters long. Furthermore, we chose the proper multi-unit abutments and using the CAD/CAM software to prepare a temporary screws retained bridge for immediate loading. This is what we are getting from the company: a surgical guide, implants, abutments, and the temporary bridge. The guided surgery follows the make it simple rule. After adapting the guide to the abutment teeth, the drilling is sequential and simple, with drilling to the predetermined stoppers of the drills. And the insertion of the implant are done through the guide. Multi-unit abutments and healing caps for suturing, adaptation of the bridge to the abutments, and the patient goes home. Digital flow work from A to Z. This is a CT scan taken from other regions 3 months after surgery. The MGUIDE softwares allow us to compare the pre- and post-op results and to check for accuracy. You can get the impression of the accuracy by transferring the digital plan to the operative field. And in numbers, the deviation from the plan in all 3 dimensions, lateral, mesiodistal, and vertical, was less than 1 millimeter, and the angle deviation less than 4 degrees. However, maybe in the future, we will use active navigating systems based on computer gaming, which is natural for the current generation. This is the system by Wii of Nintendo. In this system, 2 infrared sensors tracking the emitters, which are in the hand of the player. It transmits to the computer, and from there to the screen. The computer always knows where your end is. Now you can see it in action with my son playing. For him, it's a piece of cake, but not for me. You can see also it's a Barca fan. Same system was translated to implant dentistry, and it is on the market already. The emitters are in the hand of the surgeon and in the patient mouth. They are sending the signals to the computer, and you can see it in real time on the CT scan, where the bar is during the drilling process, and you can follow the pre-made plan. Here you can see the screenshot of one of the prototypes of the systems. You can see it visually or in the control panel, where you can see the location, angle, and depth of the burr. So in this short video, you can watch a demonstration of one of the first prototypes of this kind of active systems. 3 implants were planned in the maxilla, and the surgery was carried out with the system. Please watch the surgical procedure, as well as the overlay screen, where you can see the computer screen and the control panel. This is fun, no? Computer toy in the clinic. I'm a big fan of gadgets, and I'm sure most of you are. Let's play. We just follow the protocol. Depth, red. This is the future. Definition of CAD/CAM dentistry from Wikipedia. It is the field of computer-aided design and manufacturing to improve the design and creative of dental restorations and orthodontics. Can we take it one step further? Can we play human tissues on the computer? Can we create them by the same CAD/CAM technology? This is the case of a broken bridge that was sent to us for implant in the upper right jaw. As you can see, from the segments of the cone beam CT, the bone is very thin in the area need bone augmentation in the lateral direction. This is the clinical situation prior to bone augmentation. We grafted the area 2 months earlier with a free gingival graft to prepare the soft tissue for bone grafting. And we are going for a digital planning and manufacturing of bone. The software is very similar to the M-Guide. Based on the same platform, we can see the missing teeth and the obvious lack of bone in the 2D and 3D imaging. First, we plan the future placement of implant in the software. This will direct us where and when we need the bone. It will dictate the width and the length of the bone graft. And now we can plan the graft, and we need to include it to the future implants. The blue lines are describing the outlines of the planned graft, and we can see it now in 3 dimensions. We can get the impression how the bone looks, and in blue is the size of the graft that we need. After finalization of the plan, It can be sent to a milling machine. They prepare for us a personal allograft block for our patients. And this is the block that we get. And this is the patient bone, exactly as we saw in the 3D model. And this is the graft exactly fitting to the patient bone. I'm sure that you all know how it's hard to adapt a block graft to a patient bone, and this saves us time and make it much better than we can do it by ourselves. The computer makes our life easier, but it cannot replace biology. Remember Leonardo? Respect biology. We are going to follow the rules of guided bone regeneration step by step. Stabilization, the graft is stabilized with screws, and the adaptation is clear and fast. A long-term linked cross-linked collagen membranes, O6 Plus, is covering the graft and stabilized with internal periostal sutures. This is the clinical view area after healing, and this is the CT scans of the regeneration area before and 6 months post-op. The picture speaks for itself. Now you can see and get an impression from the serial CT sections, as well from the clinical situation of the implant during surgical placement. Thank you very much for the time and for your attention.